Hi, everyone. I'm Stephanie with 9Health. Thank you again for joining us for another virtual town hall. I'm trying to figure out why we're getting a little bit of an echo here. Give me 1 second. We are joining you today. I have a bunch of mental health experts with me, along with Dr. Payal Kohli, our 9Health expert. But during this time of the coronavirus, understandably, a lot of us are very worried, maybe uneasy, experiencing anxiety, stress. Really, the way our lives have changed, the way we live our lives has changed dramatically in just a short period of time. So I think that's pretty understandable to feel that way for most of us. So I just wanted we wanted to bring together these experts to check in on everyone's mental health, give you some tips. You can ask your questions about coronavirus, mental health, really anything that you need answered. Let me introduce our experts. We have, again, 9Health expert, Dr. Payal Kohli. She's a preventive medicine physician. She's a cardiologist, expert in all things coronavirus now, since that is what she has been talking about on 9 News extensively. I have Dr. Eric French. He's a psychiatrist at the Health One Behavioral Health and Wellness Center in Aurora. Jennifer Elper, she's a licensed clinical social worker, and she's an alcohol drug therapist. She's also a leadership volunteer for 9Health. So she is one of our great volunteers that works with us in our health fairs when those go on. We have Jason Youngblood. He's from Cigna. He's a licensed professional counselor, and Cigna has partnered with 9Health to build out some of our free online screenings at 9healthfair.org and access free counseling. Again, you can find mental health screenings at 9healthfair.org. Just click on our e-tools. I also have Patrick Harrington. He's the founder, owner, and chief vision officer of Kindness Yoga. So he's going to bring some Zen to all of this for us, and that yoga perspective as well, because that is getting moving, doing some yoga and breathing, just taking some time out to breathe and taking a moment is something that's very helpful to our mental health. So first, Dr. Kohli, I want to give you a chance. I think it's helpful for everyone to be informed and get an update on what is going on. So can you kind of tell us the latest of what is happening right now today with the coronavirus in our state?
Yeah, so as of the most recent numbers nationally, we have about 64,100 cases. And in our state, we have 912 cases with 11 deaths. And yesterday was actually a big day for our country because we had the most number of deaths in a single day in the United States, which was 185 deaths. We did get some good news this morning from New York, our first kind of glimmer of hope that maybe social distancing might be doing something, where Governor Cuomo said in a press conference that the rate of doubling of the virus was every 2 days, then went to every 3 days, and now it's slowing down to every 4 days. So again, first piece of data from the United States that social distancing may be having somewhat of an impact. Certainly, by no means we're out of the storm, because this is just the beginning, but it was at least positive to hear that.
I always forget to unmute myself. Thank you, Dr. Kohli, for that update. Again, you can post your questions in the Facebook feed on mental health, on the coronavirus. Let's go to Dr. Eric French. You see patients that deal with anxiety, and you have some good advice on starting our day, a mindfulness practice, if you will. Can you kind of share with us what that is?
Certainly. I think one of the most important things about starting your day is not by picking up your phone and tuning in immediately to the COVID news and sort of resisting that temptation and taking a few moments to just allow yourself to wake up and breathe and maybe practice some gratitude, some mindfulness practice where essentially you're just slowing your thoughts down to the singular thought of following your breath. And that really just slows the body down. It allows us to sort of loosen that anxiety and to reset. And that can be done as often as you need throughout the day.
Yeah, I think that's a great, as much as I want people to wake up and look at 9healthfair.org, look at 9 News, figure out the latest of what's going on, it is good to just kind of ease into your day. And for a lot of us right now, maybe watching the news isn't the best thing for us. Jennifer Elper, she's a licensed social worker again, alcohol drug therapist. I wanted to talk to you about some signs that we may look for in ourselves or loved ones that could be struggling at this time. I'm trying to unmute her for us. Jennifer, if you can unmute. There we go.
Yep, there we go. So some of the things you might notice in a loved one is a change in behaviors such as sleeping more or sleeping less. So change in sleep patterns, change in eating patterns, possibly engaging in like binge eating or emotional eating. isolating more, although we are being requested to stay at home. It might be that maybe somebody's staying in their bedroom longer than they normally have been, or just isolating in a corner. So increased isolation, talking more negatively, maybe expressions about feeling increased loneliness, maybe increased negative self-talk that they are expressing as well. Worst case scenario, maybe talking about not wanting to live anymore, or how awful life is. Those would be some of the symptoms that you might see. Emotional outbursts. Yeah, those are, more angry, more irritable, increased anxiety, increased depressive symptoms. If they're already engaged in or dealing with diagnoses such as obsessive compulsive disorder or depression or an anxiety, that loved one might notice an increase in those symptoms. They might stop taking some of their medications or playing around with their medications, especially if there's a concern about being able to access their medications because they can't get to the pharmacy, or the pharmacy has a long wait list in filling orders, so that might increase their anxiety. And certainly, as Dr. French indicated, if they're watching too much TV about COVID or listening to the radio too much about COVID, that could contribute to some of these behaviors in our loved ones that I mentioned. And there are others, but this is just like a short list of what you might see as far as changes in a loved one.
Right, and we'll talk about resources as well as we go along here. I'm trying to give everyone a chance to kind of introduce themselves if they'd like, but I'm asking each one of you a question and showing everyone all the experts that we have available to answer questions today. Jason Youngblood, again from Cigna. He's a licensed professional counselor. Jason, you have a focus on the mind-body connection,
right?
Whole person health, really. Tell us about that and why it is so important, especially in times like this.
Yes, absolutely. So I am a licensed professional counselor, but I also have my personal trainer certification. Prior to this, when I was seeing people in my office and they would present with anxiety or depression, I realized that a lot of their symptoms their behavioral symptoms could be mediated by what they put in their body and what they did with their body. And so, as Jennifer was just mentioning, some of those symptoms that aren't necessarily related to your mind will show up in your body, like problems sleeping, having too much energy or not enough energy. You really have to pay attention, I think, now to what's going on with your body, because what goes on with your body impacts your mind. So I definitely recommend pay attention to sleep. If your sleep pattern changes, if you're sleeping a lot more than you had been or a lot less, I've been waking up with the additional stress in the middle of the night and having a hard time go back to sleep. It's normal under stress for that to happen. There's lots of snacks right now in my house. It's like Pop-Tarts, which typically aren't part of my diet, but under a little bit of stress, I want to eat that stuff maybe a little bit more, but then I feel a little bit worse. And so it's important to realize, in order for you to cope with stress and to kind of function under this increased stress that we are, you have to keep that mind-body balance. And when that gets out of whack, that will show up in additional stress symptoms.
And we did get a question on Facebook. I'm not sure who the best person is to answer this. I'm going to put it out there. You can kind of maybe raise your hand, but maybe it's Jason Youngblood, Jennifer Alpers, Dr. French, maybe Dr. Kohli. Someone's asking about, they deal with severe ADHD on a daily basis. So being at home, not having a lot to do is kind of posing a problem for them. Anyone want to take that on as some things they can maybe do to help them in their day-to-day life right now?
I don't mind speaking to that. Certainly, if the goal for someone with ADHD is to have a lot of irons in the fire, more projects, you can certainly think about what you have available to you in your home and plan out different activities. Set yourself a schedule and stay by it, but keep yourself occupied. Even if you have to do that in short bursts. We always talk about how if I had more time, I'd read that book or pour through that podcast, or I'd do this or that in my home. Now is the opportunity to do that. And, people should feel free to seize those opportunities and fill their day with constructive things.
Yeah, I think that's good advice for all of us, really. Just have a schedule, try to stick to some kind of schedule every day, especially if you're just in your home. Patrick Harrington, founder, owner, chief vision officer of Kindness Yoga. I want to give you a chance to speak as well. Yoga, obviously a way to decrease stress, anxiety. Not everyone may do yoga or even has ever done yoga. So what is maybe something you recommend to help them in their mental state if they've never really participated in yoga or can't turn to that, I guess?
Yeah, sure. Thank you. I think Jason pointed at it, and it really has to do with where your attention lives. And I think that so often what yoga addresses and where so much of the health benefits come from is that through a movement practice, you're able to get in touch with where you're holding tension and kind of how your lifestyle is affecting you. And one of the things that I keep saying to myself right now is the who I've been up until now isn't adequate to address this problem as we're going. And in other words, this is this opportunity for me to really look at my daily ritual. And I think, you know, up until now, my life has been pretty comfortable in comparison to how it looks right now. And I've been able to get away with not really being disciplined on my daily rituals as much as I maybe could have been. And now the problem is so big. It's so kind of all encompassing that I think our daily rituals and what Dr. Eric spoke about as well is really creating ceremony and ritual on a daily basis that has you think of something bigger than yourself. Whatever your spiritual tradition or belief is, take a moment every day or multiple times throughout the day and just remember that you know, you're connected to something bigger than yourself. If you're spending a lot of time by yourself, there's a way of just putting yourself in a place around ritual and around ceremony on a daily basis with a schedule that says, I'm going to on purpose, because the problem is bigger than it has been, I'm going to on purpose remember to connect myself to what I know for me is higher power, bigger version of myself, and really give some of this tension over in that way, because it's a lot to handle right now, and it's particularly if you're feeling isolated. So that's not exactly yoga, but I think that the practice of yoga is a ritual that people do with a similar end result.
Yeah, I agree. I think that was well said. And yeah, again, going back to having a structure for our day, I think is helpful right now. It's something I'm definitely struggling with. Dr. Kohli, I'm just looking at some of the questions we've been getting, a couple generally about the coronavirus. Is there a Colorado County that you know of right now that doesn't have any cases? And then someone had asked if having pneumonia in the past puts them in a higher risk category. I don't know if you can answer either of those questions.
I'm not sure about which counties have had cases. I do know there's a county up near Telluride that is actually testing every member of the county with a blood test. So that tells us not just about present infection, but also about previous infection that they may have recovered from. And I think that county is really setting a model for the rest of the country as to what may be coming on the horizon. And the second question was?
I think you answered both of them. I asked about the county and then the pneumonia. So if you've had pneumonia in the past, if that puts you at higher risk.
I mean, it depends on the circumstances under which you had the pneumonia and whether there was any problems with permanent lung function. But in general, if you've had a susceptibility to catch an infection before, you may be slightly more susceptible for secondary infections if you've got the COVID infection. So I would say, because this is a respiratory virus, any prior history of lung conditions may slightly increase your risk, including pneumonia.
Okay. Again, this is the 9Health virtual town hall. This week, we're focusing on your mental health and the coronavirus. Dr. Payal Kohli is answering some of the general questions about coronavirus and your mental health as well, but we have several experts that have joined us. While we're on some general questions, Dr. Kohli, we've talked about this a little bit, but someone asked about, can you get the virus from fast food? So I guess, I don't know if that means like the takeout containers or if that means the food in general. Maybe you can talk about both of those.
Yeah, well, the good news is that so far there have been no documented cases of individuals contracting the virus through foodborne transmission. But having said that, there have been multiple reports of possibility of fecal oral spread, which means if somebody goes to the bathroom, doesn't wash their hands, and then prepares your food, it's possible your food could get contaminated. And certainly from New England Journal of Medicine last week, we learned that the virus can survive on cardboard for up to 24 hours and on plastic for up to 3 days. So if the food is stored in containers that may be contaminated, that could increase your risk as well. So what I generally say is the safest option is probably to cook at home, but we do want to support our local restaurants. And so if you decide you want to carry out, there's just a few tips to keep in mind. First is to probably get cooked food rather than uncooked. So rather than salads or sandwiches, try to get something that's cooked that you can microwave before you consume. The other piece of advice would be to take it out of the containers that it comes in and put it in your own containers before you microwave it. And then finally, be real careful when you're paying for the food, because that's one of those times where you're exchanging cash or credit cards and that social distancing piece, may not apply. And then finally, throw away the packaging and make sure to wash your hands before you consume the food.
Yeah, because I think it's good, obviously, to still support some of our local restaurants. And speaking about mental health, just coming up with something for dinner every night is kind of mentally tasking right now. Dr. Eric French, we got a good question that I think you might be able to answer. People are talking about, how do you know a balance between being paranoid and whether you're being paranoid or you're being careful like you should be? So is there kind of that balance between careful and actually being scared and paranoid?
And that's a great question, because it's really kind of a fine line. And essentially what we need to have is enough self-awareness to say, there is far too much of this that is consuming my mental real estate. Once it strays over to the side where it's all consuming and there really is no balance anymore, nothing else that you're thinking about, nothing else that you're planning for, now we've strayed into the realm of maladaptive, and that's going to have a huge impact on someone's level of anxiety, their ability to cope. And so in order to identify that, we do have to have some semblance of self-awareness to say, how am I feeling right now? Just checking in with yourself. If you feel that increased muscle tension, the fact that you're restless, maybe a little more irritable, prone to outbursts, this is signs that you're spending too much time on the COVID-19, whether that's binging on news and social media, or just not allowing yourself to concentrate on favorite activities or time with family. So it is a delicate balance. And the fact of the matter is, when we think about this, we do have to think of it in terms of our mental real estate and how much real estate is taken up by all of this.
I think there's different levels of anxiety, right? So how do you really know? Jennifer Elpers touched on this a little bit, but how do you really know when you need to seek help? And do you have issues, I guess, I don't know that you would know this, but with people actually going to seek help, like they don't really think they need it? If you can follow up with that, Dr. French.
Certainly, there are people who try to have a stiff upper lip, just kind of push through, put their heads down and shoulder through, things like this. I think it's time to start looking for help when it's affecting the way that you function. In other words, you aren't interacting well, whether you're working from home or whether you're communicating with family members. If this trickles into facets of your daily functioning and is disrupting that, it's time to ask for some help, because that's strayed into other aspects of your life. It's now creeping into the way that you function.
And then I did want to, if anyone else wants to talk about as well, just this balance between being scared and being paranoid. Jennifer Elpers, maybe you can talk about it a little bit as well. When do you know when you've reached more of a paranoid state that maybe isn't as healthy as opposed to just being safe and cautious?
Well, I think like Dr. French said, if it's really spilling over into other areas of your life, if it's really consuming you, so prior to COVID-19, if your day was to be focused on work and your family and your friends and your Facebooking, but now you find yourself worrying more, you're ruminating about the virus and what surfaces it might be on, and is it in my stomach? So if you notice an increase in that sort of behavior, then that is a red flag. And you can try some self-help techniques, such as a thought stopping is a cognitive technique where when you find yourself worrying about what surfaces a virus is on, for example, You catch yourself in that thinking, and you tell yourself, okay, I'm not going to think about this right now. It's not helpful. And you redirect your thinking. So that's a technique that you can employ to try and help yourself. But again, after employing numerous techniques and you're finding that you're still ruminating and worrying excessively, and it's consuming, as Dr. French said, the real estate in your brain, then that's an indication that you need outside help, something outside yourself. And sometimes talking to friends and family can help, but some of this stuff gets to the point where you're actually needing a professional and possibly short-term help with the medication. So to avoid getting to that point where you need to seek outside help, as you learn about some of these strategies now, to really be self-assessing and working on not starting your day with the news every day and spending hours on the internet reading about COVID and talking about COVID, is you really want to try and maintain some sort of routine in your life, getting up and putting on work clothes and working from home at your desk and setting goals for yourself daily, etc. So really trying to prevent crossing that line of this being a chronic issue.
Yeah, I think that was good. And Jason Youngblood, I want to give you kind of the same question and maybe tips for if you are being paranoid, you know, kind of to come back away from that a little bit.
Yeah. You know, I think, how can you tell it's a problem? If you think it's a problem, then it's probably a problem. If it's bothering you to the point where it's keeping you from doing other important things in your life, then it's obviously a problem. And I think that there's, you know, the first thing that maybe you want to do is think about just getting what's inside your head outside of your head, because I know in my own head, I tend to be very anxious, and it is very quick how one little scary thought can germinate and grow and become enormous and overwhelming in a split second. And that's normal. And I think, you know, everyone just forgive yourself right now, because this is just, that's normal. But if that is keeping you from taking care of your kids, doing your laundry, doing work, then it's an issue. So talk about it with a friend, talk about it with a family member, get their reactions. You know, you might want to be careful. Like, I don't talk to my mom about some things because she tends to over worry about me. So I talk to my best friend, who kind of is a good person to know to balance me out. My wife talks to me about things. And so I think just having someone to talk about it, just do that. The other thing that I would say, if you exercised prior to this and now your gym is closed and the parks that you went to are closed, you know, exercising probably was a way that your body discharged some of that paranoia or angst or anxiety. If you're not doing that now, then your body could be kind of overreacting. So I would say, think about, you know, rather than thinking about seeking treatment, which may be important, but, you know, look to get that energy out physically. There's lots you can do in your home. Go for a walk, stay socially distant, do some push-ups, do whatever it is that you could do for 30 minutes, but give your body a way to physically discharge that. I think yoga is a great way. I store my tension and anxiety in my shoulders. And when I do yoga every once in a while, I can actually feel myself decompress and come down. I can actually feel the anxiety kind of pouring out of my body.
I think that's good. And on that note, I should go to Patrick Harrington with Kindness Yoga. And kind of the same question, you know, with being paranoid versus being careful, but also just, you know, some techniques in addition to yoga. I mean, we say just breathe all the time, and for some that may or may not be easy, but talk about some of the health benefits that really can happen, mental health benefits, when you do just take a minute to breathe and relax a little bit.
Yeah, absolutely. And I think it's important to point at the idea that so much of what we're talking about here today can be kind of classified as a practice. And it's one of my favorite things about, you know, calling it a yoga practice, is that it's not yoga perfect. It's not, you know, life is a practice. It's not life perfect. And so starting some of these ideas of, like, even a thought interrupt, as Jennifer mentioned, you know, you may remember to do that sometimes and then forget to do it sometimes, and you practice it. And so one of the things that I have started to do is I have a little note on my computer that says breathe. And so I'll find myself just looking at, oh yeah, right, take a breath. And when you take a breath, a deep breath, I mean, we could all do one right now. Everybody watching could just take a deep breath. And when you exhale, you can feel just a little bit better. And so much of what I do for my own life is I want to feel just a little bit better every moment. Just a little bit, just a little bit. It's that whole kind of like 1%. And this idea of like, I'm going to go from feeling paranoid to, you know, just being safe. That might be, you know, many moments of catching yourself before, oh gosh, I've practiced all day. And by the evening, I'm actually just feeling safe. And so, you know, if wiping off the handles on your house, on your doors and stuff like that in the morning feels good. And then if you go out, taking care of yourself when you come in and those kind of things, if there's a ritual to how you keep yourself safe versus paranoid, you might have to practice a few different things and make it a ritual that, you know, when our kids come in, they now really know they go straight to the bathroom and wash their hands. And it's just part of their ritual for being safe. And so how can you set up your life in a way that you might not have before because this situation wasn't here before? And so it's actually calling us to be more and, you know, better to ourselves. Self-care is up more than ever before. So I think self-care is a big way, like Jason said, that if you're taking care of your self-care, if you're exercising, if you're meditating, there's lots of meditation apps you can check out. You're going to find that your mental state is becoming more and more stable. Thank you. You're muted.
Someone even said, you know, yoga works, people, in our comments. So if you can do some yoga, and Patrick's going to join me tomorrow. We're going to go through some, you know, some simple moves maybe you can do, because I'm having trouble. I've done yoga, I do yoga, but I'm just having trouble finding a time window in my day. But I have my office, I have my own home office, so I can just take a 5-minute break and do a couple moves. I think we can go over some of that, but he'll join me tomorrow and we'll kind of talk about that. Dr. Eric French has to leave here, I think, in a little bit, probably right now, but I wanted to ask you one more question before you pop off of here. Someone did ask in the Facebook feed concerning mental health. They have GAD, so general anxiety disorder, I believe is what that is, and mild to moderate depression. Medication's one of their treatments, but because they're controlled substances, what happens if pharmacy close and meds can't be filled? And I want to reiterate, and I think the governor just put in, you know, a shelter, I don't know how he phrased it. Let me look at how he phrased it. Stay-at-home order for the whole state. The governor just put that in place. Goes into effect at 6 a.m. tomorrow until April 11th. But there should be essential services under that are exempt, including pharmacies, correct?
And that is correct. And if we're talking about the types of medications that manage anxiety that are controlled substances, the reason that we wouldn't fall off on that is because that can be potentially dangerous to an individual's body. So really just reaching out to your outpatient provider. If you're having difficulty reaching your provider, reaching out to your primary care physician. I think we're all in a state at this point where we recognize the need to be flexible and to accommodate our patients, because, you know, many of them don't want to come out and come to the office and are being discouraged to do so. And so maybe trying to investigate some telehealth options. You may be able to connect with your provider via that method, but you will not be allowed to run out of these types of medications, particularly during this time. I think that would be horrible, and would not want to see any patient go through that. So I would say to rest assured, knowing that the pharmacies and your outpatient providers are going to be there to support you. Just because the offices are closed doesn't mean that you can't reach them.
Yeah, I think that's a good point. I'm just making sure that we are still going live to our Facebook feed. I was getting a weird error on my phone. So I'm making sure that we are still on there, still going live. But while we're still recording this, we're still doing this on other channels as well. I do want to pose the question to everyone on teens and anxiety, maybe even just children and anxiety. But maybe we could start specifically with teens. And Dr. Eric French, if you have to pop off of here, just kind of give us a wave. But otherwise, we'll keep going here. Dr. Kohli, maybe you can talk about teens and anxiety and kind of helping a younger age group with those feelings.
CDC has identified both children and adolescents as a higher risk group for developing anxiety problems during the COVID pandemic. And that's mainly because of a few reasons. One, I think, is sort of the lack of understanding maybe of the concepts of social distancing, why it's effective and why it works. And the second one, which kind of goes hand in hand with what most of us are feeling, is that social isolation and separation from their friends. The other thing in terms of teens is you just have to be careful about substance abuse, things like vaping and marijuana, because that can certainly go up as well during a time of anxiety like this. So I think the first and most important step is to make sure that you talk to your teen and connect with them, because they're considered one of those high-risk groups when it comes to anxiety, mental health problems at a time like this. And then the second thing is to make sure that you have set up some sort of a support network for them, or some sort of a way for them to maintain as much normalcy in their lives as they previously had, whether that's trying to help them connect with their friends, college roommates and such on Facebook, or whether that's checking in with them yourself or taking some time out of your day every day to make sure that they're okay. But I cannot emphasize enough that you should pay attention, to that group, because it's already a vulnerable period just with all the changes in life and then with all the changes we're having.
Yeah, I think that would be the thing I would struggle with most is if I was a teen going through this is, you don't get to see that social network that you have outside of the home. And well, it's hard for all of us as adults too, but I think it would especially be hard for the younger age group. Jennifer Alpers, I want to open it up to you to kind of answer the same question, just helping that younger age group, teens, as a licensed clinical social worker, how do you talk to families and younger age groups about that kind of thing?
Well, some of the conversations I've had thus far with parents is encouraging them to be confident and calm in their role modeling for children, because that will be very helpful to children if they can see that the adults in the household are not panicked. Because if a parent is elevated in their mood and their speech, their tone of voice about this, then that just lends to anxiety and fears for children that are not necessarily warranted. Also, I think continuing to provide structure for children is really helpful, because that's what's normal to them, so getting up at about the same time and eating breakfast, and trying to do some sort of educational fun activities at home, so that they can feel some sense of quote unquote normalcy, and telling kids that they're safe, that they're going to continue to be safe. Children often want that reassurance that, this germ isn't going to be a monster walking through the front door and get to them, that they are going to still be safe. And figuring out ways to help each child deal with their concerns around this is another task for a parent, because what works for one kid may not work for the next kid. And so going to websites such as the Center for Disease Control or the National Alliance for the Mentally Ill, or other websites for parents and teens and support to figure out, okay, what are other parents doing? Certainly talking to other family members and other parents on Facebook and other social media platforms can help a parent come up with some ideas as to how to handle their child. Empowering Parents is a website that I sometimes refer parents to, and that oftentimes has some pretty good ideas for parents to try with their children. But in essence, I would say staying calm, being confident, talking with your children. Don't try to soft pedal it, but figure out a way to educate your children. Educate's quantifier there, about what this virus is about, how they can get it. And like some of the other folks here, Jason and our yoga guy here talked about, get into a routine of how do you clean your home, and how do you sanitize it to feel safe, and washing your hands, and putting your food items that you got from the grocery store on the floor, unload from the floor, not from the counter. Any of those sort of protocols to help children feel more soothed during this time. And then, of course, I do talk with parents about watching out for the use of substances, because that's an easy go-to for, for some kids.
Yep. Hey, could I just add? So today's my daughter's 17th birthday. And so she's celebrating at home, socially isolated, which I think is every teenager's worst nightmare. And as I realize, as the schools have closed down now for a few months, she's missing out on her junior prom. She's missing out on birthday with her friends and so much more. And so is my 10-year-old. And so is every college student whose college has closed. And what I recognize in my child, and as I talk to my friends about their children, that there's a bit of mourning going on right now. And so I'm just reminding myself and my friends to be patient and to understand and to really think about, well, we're worried about, you know, paying the bills and our economy and our 401ks and getting back to work and all of those things. This really is a big deal for our kids, and to have more patience with them, maybe to take an extra breath, because raising kids without a pandemic is a huge challenge. But they are really going through a lot right now, and just take a few extra breaths and be there and ready to talk when they're ready.
Yeah.
Well, and I think that's a good point to highlight, is that there is a lot of grieving going on right now, and it'd be important to recognize that and let people, let kids know, let each other know that it's okay to feel this way at this time. This is a unique and challenging time, and that it's normal to feel sad that these things are not happening. I mean, I'm sad I can't get to my gym. I can't be in a group with people. That's a very sad thing for me, because being around people is energizing for me. So to stuff that and not talk about that, not acknowledge that, would not be healthy. It is healthy to have these emotions. I know other friends, they're loving this isolation thing because they're more introverts and they don't really like being around people. But if you're a person that wants to be around people and out and about, and you're a very active individual, whether you're a kid, a teenager, or an adult, this is a very challenging time, and there are losses. We're all experiencing losses of all different kinds. So it's healthy to feel it and to talk about it, and to let kids know it's okay.
Yeah, and Dr. Kohli, maybe you have a good answer for me. But one of the things my 4-year-old keeps saying, so not in the teenage group, and happy birthday to your daughter, Jason. That would be super hard. I can't imagine turning 17 and having to have like a Zoom meeting party or something. But Dr. Kohli, my 4-year-old keeps saying, I tell him we can't go to grandma's house, we can't go to a friend's house. And he's like, well, do they have a bathroom? And I'm like, yeah, well, they have a bathroom. And he's like, well, do they have a sink? I'm like, yeah, then I can wash my hands. So I don't know if there's a good answer that you can communicate to a 4-year-old about, yeah, true, we can wash our hands and they have a bathroom, but we probably still shouldn't go to their house.
So I would say, and maybe you could put it in kid terms here, but there's 2 levels of protection. One is an individual level protection, and that's where the washing the hands comes in, because that's the individual protecting themselves. The second is the community level protection, and that's where the social distancing comes in, because just by being next to somebody else, you're automatically being exposed to every person that person has been exposed to, and your risk of exposure goes up, and their risk of exposure goes up, because it applies both ways. So I would say washing hands is a kind of a grandma level thing. It protects grandma, but staying away from grandma protects all of us, including grandma, because, we're not able to kind of breathe the same air that grandma's breathing. So something like that to sort of explain why the social distancing is a community level measure, whereas washing hands is more of an individual measure.
And I liked yesterday during our Facebook Live, you called it physical distancing, but we can still socialize virtually. I think that helps mentally for some as well. And Jason Youngblood, I wanted to put another question to you. We're getting this, you kind of mentioned it, but we're getting some questions about, just financial stress in general. So maybe tips for kind of mentally dealing with all the financial stress that's coming along with this right now.
That's a tough one. We're in areas that are like we haven't been before, and our economy, I mean, when I look at the stock market, it's up and down and all over the place. I don't know which way to turn. So one of the things I have a friend who I hope is not watching, and he calls me like every 45 minutes to give me the updates, and I had to tell him, like, listen, put the phone down. You put it away. If you can't change your behavior, if you can't do anything about it, then what good is it for you to follow it this closely? Because it is preventing you from functioning throughout the day. So sometimes, there are things that you can control and things that you can't control. And so that's true with finances as well. Focus on what you have control over and what you can control. And perhaps when you're thinking about, you know, what information you're looking at and what you're watching with the stocks and things like that, you know, maybe step away for a little while, realize, you know, think about where you are with your financial goals. Maybe you have a little bit towards retirement, you can rebound. But one of the things that I would suggest is that if you are having concerns about it, if you have an employee assistance program, one of the things that you could do is call your employee assistance program. You can speak to a financial consultant, typically at no cost to you, about your fears and concerns and get some good information. And sometimes having access to good information about your particular issues will go a very long way towards helping to mitigate those anxieties that you may be having about it.
Can I speak? Can I say something about that, Stephanie?
Yeah, I was going to put it to you next, actually. So yes, if you would like to add to that, that'd be great.
Well, I think that one of the things that our culture has done really well is create a lot of financial affluence, and that we, I think, have been you know, as elevated by it, and we've also been really separated by that affluence. And that the fact that we all can afford to live separately as families, for example, or as individuals in an apartment building, and have much more space than other cultures and other folks maybe have with many more people in the same space. I think we've started to think about our wealth in terms of what is in our bank accounts. And right now, one of the things that I'm really pointing at for my team and for myself is that your wealth is like the top half of something, and it fluctuates like this. And oftentimes we think that death is tantamount to a zero balance. And where I go with that is that below this line in your bank account is where wealth lives. And that's your community, that's your relationships. That's how you've invested in the people that care about you. And I think that right now, one of the ways to really feel better about financial stress is to get connected to the people that you love, get connected to the people that you feel like you're in service to, where you have value. And so that's, you know, that's parents, that's children, that's brothers, that's sisters, that's best friends from high school, from college, that you may not have reason necessarily to reach out to, but they're folks that I think you can lean into, because those are the folks that, in the end of the day, most of us probably have 10 people, 100 people, where you could go and sleep in their extra room if it came to it. And in fact, it would be more intimate than you had ever been with them. It would be an opportunity for you to be closer with certain people. If things continue to get challenging, keep investing in the people that care about you. Keep investing in the people that you invest in, and ultimately, we're in this together. And so finances and challenge with financing can be so isolating. It can be my problem that I have this financial problem, but really you're much wealthier than that. That bottom half below zero, that's where that community, those are the folks that can rely on you and that you can rely on.
Yeah, I like that. I like relying on that community. At this time, you know, I still have to keep your distance, but we still have people we can rely on, obviously, to help us out. Dr. Eric French, you're still with us, so I want to put a question to you that someone asked. I don't know if they're in a medical profession, but they're saying, you know, what about people like me who they can't remove themselves from the news or the medical aspect of this whole thing because they're caring for patients? And I heard you say earlier, I mean, you're at, I think you're at Medical Center of Aurora, right?
Correct. Mm-hmm.
So you're probably going into the hospital as well, and this might be something that you're dealing with. You can't really remove yourself from this situation. So what are some maybe things you're doing personally to separate yourself from all of what's going on?
I think it is, and it's an excellent point, and it's a completely different animal. Those who really have to check into work and continue to have interactions, and that sort of baseline level of increased risk. It depends on how we speak to ourselves about it. I really, truly believe a lot of us who got into this line of work got into it to work with patients and to care for people. And this is when they need that care the most. The truth is, and this is the same thing that many of you have been saying, is that we take our individual sense of responsibility for not being part of the spread of this virus. And beyond that, we focus on what we have to do. It's far more important to me that people who need my help or they need care are receiving that than thinking about how this is going to impact me. It does increase anxiety though, and you can see it. It's, you know, it's palpable at times, but I think the way to sort of balance that, again, I keep coming back to this concept of really trying to counterbalance things that are going in the wrong direction, is to speak to yourself. The conversation in your head needs to be that you are providing care to people who need it. This is a very noble cause, and it's beautiful that people are there for these patients at this time. They need you.
Yeah, I think that's well said. We're all very thankful to all the healthcare workers out there that are taking care of all the sick people that they are getting. And yeah, it would be hard to remove yourself from that. Dr. Kohli, I don't know if you want to add to that at all as far as the healthcare workers. We talked a little bit about this on Monday, but just separating themselves and when they get home, kind of decompressing and not paying attention to all of it.
Yeah, I mean, we did talk about how healthcare workers are another one of those high-risk groups because they're really at the front lines. But I echo what Dr. French said, which is it's all about reframing the narrative in your head and taking that energy about worry and fear and trying to see if you can channel it into something positive. Now, this is not easy because if you just go inside a healthcare worker's day, they're, you know, covered in protective equipment from head to toe. They're sweating in it. They're worried about contaminating themselves. They're washing their hands all day long. They're worried about their families. So all of that is certainly looming. But I think, again, if you focus on why, not the what, but the why are you doing this and how is it going to help? I think it'll really help you get through those tough days. And as you said, it's admirable what our healthcare workers are doing. That's how I do it personally, is I keep focusing on the why.
That's a really good point. If I can just speak to that, you know, we have the choice to control to some degree what we want to be focused on. And it's not to ignore the negative thoughts or some of that negative chatter that's going on in our heads about, you know, all the what ifs, but saying that, yes, I hear you. I know I have concerns. I know I have fears, but right now I'm a part of something bigger, and I'm going to focus on that and focus on the care of the people who need it.
Yeah, I think that's good advice for really anything in our day too, just focusing on what you need to do every day. And that's kind of your why for the day, and just getting through each day right now because we're all kind of living in a weird state of things at the moment. Jennifer Alpers, I wanted to give you a chance too, if you want to chime in on, you know, separating that financial stress, dealing with some of that financial stress that we were talking about. And then also you have some good resources that we can give for people as we are all at home virtually, not going in to see therapists, counselors, leaving our houses kind of thing. If she's still on there. Jennifer, are you still there with us? I think she's frozen maybe on me. But I can pitch that question to the others. Patrick, you talked really well about all the financial stress stuff. Kindness Yoga would obviously be a resource, and you guys are doing virtual classes right now, so that's kind of a resource for people. That's a virtual resource. Maybe you can talk a little bit about how that's going and what that looks like for people.
Yeah, thank you. Yeah, for those that are interested in trying yoga for the first time, or folks that are just seeking to get back into a regular practice, kindnesscollective.com is our website, and it is really wild to be teaching something that used to have a room full of people to be in communication with, and now to be teaching to a single eye on the back of an iPhone. And really, I still laugh at my own jokes, which I think is interesting. But the goal is getting into that why that has been spoken about, which is, you know, it could be uncomfortable to have to change in the way that we care for each other. And for example, my teaching is one of the ways that I try to care for my community. And at the same time, it's like it's asking me to remember the why is to try and create a little bit of stress relief in somebody's day. The why is to try and create a little bit of perspective in somebody's day, because all of us that are caring for other people are there because caring for other people feels good to us. And so it's just this beautiful reciprocation. The teachers that are on our site, and you can find yoga in lots of places right now. So kindness has never been in competition with other yoga programs or teachers. We always say that kindness is and other teachers in the studios are in competition with the unconscious choices that people could make. And our goal is really just to raise the bar in general. And so seek out some online courses, and we'd love, of course, if you came and checked out ours at kindnesscollective.com. But the teachers that are teaching are doing it because they really care about us feeling a little bit better every day.
Yeah, I think that is good. And we have about 5 minutes here left in our live town hall. Again, this is a 9Health virtual town hall. We're focusing on mental health and the coronavirus today. We'll have another one next Wednesday, but we are trying to go live on Facebook every day with something around 3 or 4 o'clock. So be sure to kind of look for that as well. I do want to stay on the resources part of it. I think Jen is back with us. She had some good resources that she wanted to talk about as far as virtual help for people with any mental health issues. And we can kind of go around and let everyone kind of wrap up with that as we kind of wrap up this town hall. So Jen, if you are with us now, we can get that from you. I think you're still muted, Jen. I'm not able to unmute you. There it goes. All right.
Yeah. So one of the first resources I would suggest are, because I am a volunteer with 9Health there, is going to 9healthcare.org/tools. And there are a number of mental health tips on that page. There are buttons that you can select and go look at what you want to look at. There's a anxiety quiz and a depression quiz. And then, you do get your results immediately. And following those results, if you feel like you need to pursue some resources further, there's a button for Spark the Change, and that is another resource for free mental health services, along with some other tips and services on that webpage. So that's Spark the Change. And then if you're really in crisis, you can contact the Colorado Crisis Service Line, and that phone number is also on that page where you get your results for depression and anxiety. Some other resources, certainly the Center for Disease Control page, National Alliance for Mentally Ill. So if you have a family member or you yourself are struggling and or dealing with a chronic mental health illness, then NAMI, that web page, has a lot of resources. Some of those resources are online. Support groups have moved from being in person to online, for example. It has a list of activities, self-nurturing activities that you can engage in. Monitoring your negative self-talk. So lots of good information on the National Alliance for Mentally Ill. And then certainly the World Health Organization is another website that I would recommend. In addition to, like I said, the 9Health Fair webpage, National Alliance for the Mentally Ill. Also, there's the Substance Abuse Mental Health Systems Administration website, and that is where you can find information on substance abuse during resources during this COVID virus pandemic. So for any of our listeners, if they're wondering about AA meetings, for example, the majority of those have gone to online or telephonic. Also, just backing up to some of these other resources, if you are looking for telehealth, some of those websites will give you tips on how to find a good therapist through telehealth. If you have health insurance, contacting your health insurance company to find out if they will approve telehealth therapy sessions. So you can avoid going in person, although generally speaking with telehealth, it's ideally recommended to go in for at least the first visit face-to-face, although during this time, I think many health insurance companies are waiving that requirement, but again, that's something to check out. I think that's it for as far as website resources that I can come up with off the top of my head at this time.
Yeah, that was helpful, and I'll put links to those. Jennifer's passed those along to me. I'll put some links in the comments when we get off here. Again, you can take a free mental health screening at 9healthfair.org. Click on eTools when you get there, and then you'll be connected to free in-person virtual help as well. And Dr. Eric French, I don't know if you want to talk about this a little bit. Just have you been helping patients virtually through this, and are you getting even new patients right now that you are able to help during the coronavirus?
Well, my work is mostly done on an inpatient unit. And so I'm not typically seeing patients in an office at this time. But I know that we have had to be very creative with ways to reach out to patients and to make sure that they have access to healthcare. And what you see is this massive push for telehealth and creative ways to undergo therapy, whether that be in a group format online or, any other number of things that they're coming up with at this time. I feel like the technology and the ideas are just pouring out. And so I think that while we're seeing a real shift in the face of regular psychiatric care, people should be comforted knowing that we are busy trying to make sure that we reach you in some way, shape, or form, and that you have access to us.
And Jason, I want to kind of give you the same question, maybe some resources you can offer, and then just talking about telehealth. And to Dr. Eric French's point, I feel like we've been talking about telehealth and virtual visits for a while, and now it's kind of, everyone's been thrown to the wolves. You have to figure it out right now and do it right now.
Yeah, so, I work for Cigna, and we had been building out our virtual network of behavioral health providers. And I believe we're up to about 22,000 behavioral health providers across the United States that do behavioral health virtually. And so we do not require that the first session be in person. There are times when, just like a medical issue, they might say, you know what, this isn't appropriate. You need to be seen face-to-face for your symptoms. So there are those times. But so I suggest if you have insurance, call your insurance company. I know that our colleagues out in the field are putting together lots of programs to make sure that people get connected to what they want. I can't stress enough, if you or somebody in your household is employed and you have an employee assistance program, they often include visits, free visits for you or anybody who lives in your household, and you can access those virtually as well. And those can range up between 3 visits at no cost all the way up to 10 visits, in addition to work-life support, so legal and financial. There's a lot of resources, in addition to what Jennifer said, available through your employer groups. And if you're employed, you know what, it doesn't hurt to call the benefits office if you have a question about how to navigate, and they might have resources available to you as well.
I think that's well said and gives a good insight into maybe what your insurance may or may not cover, but just contact them, before you reach out to maybe a provider, if you have a provider in mind. Dr. Kohli, before we get off, I do have one more question. It came from YouTube, and it's kind of a general coronavirus question, but also points to the resources that are out there. So just speaking of resources, our healthcare providers are in need of, personal protective equipment. They're short on resources for protecting themselves as they take care of all of us. What, if the public has N95 masks, they can donate, or other things they can donate. How does that work? Can you talk about that a little bit?
Yeah, I would say if you have N95 masks or gloves or other personal protective equipment that's unopened and unused, that's really the optimal type of equipment to donate, because it's least likely to be contaminated. If you've used it or it's open, then you may want to reach out to local hospitals or anyone who's doing a drive and talk to them about it. And a lot of people are working on making masks as well, which I commend. But I'll just say a couple of things about that, which is the science of homemade masks is highly dependent on the material that you use to make the mask, and also how well it fits onto your face, meaning how tight a fit it has. And in some circumstances, if the mask is very loose fitting, it can actually increase the risk of infection or contamination. So make sure you reach out to the hospitals that you're thinking about donating these masks to and ask them. A lot of them have templates or prototypes for sewing the mask before you put a lot of effort into making the masks.
All right, I think that's great advice as well. And we're just past 5 o'clock, so I'm going to try and wrap us up here. Thank you all again for joining us. I did want to bring up that, you know, while everyone has a lot of questions, this town hall is part of the answer, but not everyone has access to get on Facebook, to get online, even to watch these virtual town halls. So people don't interact that way. So if you know someone that is like that, 9Health is starting something new. It's called 9Health Neighbors. We have hundreds of medical professionals and medical volunteers that we work with that are volunteering their time for their community. We're giving you a chance to call us and we will connect you with them. If you have any questions, medical questions, just need to connect with someone on a personal level, just talk to someone. You can give us a call. That number, and I'll put it in the comments when we get off here, is 303-698-4455, extension 2005. And hopefully you got that because my 4-year-old's coming in the room to ask me questions. Be quiet for 1 more minute. So you can say hi if you want. So Casey won't stop talking. We'll put the 4-year-old on. So I want to get us off of here though. Again, if you have any more questions, you can put those in the comments. I will connect you to the expert that can answer those. And thank you again, everyone, for joining us. We are going to sign off here.
Thank you for the invite.
Thank you.
Thank you.